If you're an employer, you need to know if the Affordable Care Act's employer mandate requires you to offer health insurance coverage to your employees. You can find out by calculating your number of full-time equivalent employees to determine if you're an ALE. In this video, I'll show you how to do just that. What is an ALE? An applicable large employer is an organization that has 50 or more FTEs. Under the ACA, ALEs must offer health insurance policies to at least 95% of their full-time employees and their dependents, or potentially be subject to a tax penalty. Your health plan must meet the following requirements to satisfy the employer mandate. It must provide minimum essential coverage. The IRS must consider the coverage affordable. This means the lowest cost self-only health coverage can't exceed a threshold of 8.39% of an individual employee's household income in 2024. The plan must provide minimum value. This means the plan has to cover at least 60% of the average costs for a standard population, which is the actuarial value of bronze tier plans on the individual market. What is an FTE employee? The ACA considers an individual employee full-time if they average at least 30 hours per week, or at least 130 hours per month. While 30 hours per week is the minimum number of hours needed for the ACA to classify an employee as full-time, many company policies consider a 40-hour work week full-time hours. However, a full-time equivalent is essentially a unit of measurement. It's the total number of full-time and part-time employees at an organization. For FTE purposes, the ACA takes into account the part-time hours of employees who work fewer than 30 weekly hours. How do you calculate monthly FTEs? To determine if your company is an ALE, you must include all FTEs in your total number. To calculate the full-time equivalent of part-time employees, add the actual hours worked by all part-time workers in the previous year, including seasonal or temporary workers, in a single month, and divide the total by 120. This gives you the number of FTEs in your part-time workforce. Then add the number of full-time employees at your organization, anyone who works 30 or more hours each week, to the number you got in the step above to get the total number of FTEs. To look at it another way, check out this formula. What are the health insurance options for ALEs? Traditional group health insurance is the most popular way to offer your employees health coverage, but it's also the most expensive. A cost-effective alternative for ALEs is a health reimbursement arrangement. An HRA is a tax-free health benefit employers use to reimburse employees for individual health insurance premiums and qualified out-of-pocket medical expenses. With an HRA, you set a monthly allowance that individual employees can spend on healthcare costs. Once employees make an approved purchase, you reimburse them up to their allowance amount. Here are two HRAs that work best for ALEs. The Individual Coverage HRA. The ICHRA is only available to employees with an individual health plan. Employers can set different allowance amounts based on 11 employee classes to make it easier to customize the benefit. The Group Coverage HRA. The GICHRA, also known as an integrated HRA, works alongside a group health plan. It helps cover expenses that the group policy doesn't fully cover, like deductibles and coinsurance. While the law doesn't require all businesses to offer health insurance to their workers, employers with 50 or more FTEs are ALEs and must comply with the employer mandate. To learn more, you can read our article on this topic. We provided a link to it in the description. If you're an employer looking to provide employee benefits, PeopleKeep can help. Our personalized benefits administration platform makes it easy to set up and manage HRAs in just minutes each month. If you found this video helpful, be sure to give us a like and subscribe to our channel for more employee benefits and small business tips. Thanks for watching.